Of weight loss surgery, including how to determine if you're a candidate for it, possible non-surgical alternatives, and both the surgery and recovery process.
We are joined in-house by a panel of experts from CNOS. Dr. Jim Hegvik, a general surgeon who specializes in weight loss surgery, and the members of his team. Brenda Von Skoik, a physician assistant. Megan Cleveland, a registered dietitian. And Angela Swartus, a registered nurse at CNOS.
And on top of all our questions, we're answering your questions as well tonight throughout the entire show and continuing afterwards on our News 4 Now streaming app. All you have to do is send them to us right now via social media, and we'll try and get you an answer.
We're going to start tonight with a question for Dr. Hegvik. Dr. Hegvik, what are the most common types of bariatric surgery? How do they differ in terms of the procedure and the results? And more specifically, what are the two procedures offered at CNOS?
So the most common types are the sleeve gastrectomy and the gastric bypass. The results are very similar. Maybe a little bit more weight loss with the gastric bypass and a little more help with reflux control. And those are the two that we offer here at CNOS.
And what's the time difference in performing the two surgeries?
So length of time for this, yeah. So they both take about under 2 hours. The sleeve is about 30 to 45 minutes. The bypass, usually about 2 hours.
Okay. Now, what are the general eligibility criteria, kind of the requirements for someone who's considering bariatric surgery?
So when we talk about that, I talk with my patients that BMIs between 35 and 40, usually have to have a medically treated comorbid condition. So what that means is something like high blood pressure, high cholesterol, maybe sleep apnea, something that their doctor is seeing them for that's related to their weight or the obesity. Usually if you have a BMI of over 40, you don't have to have a treated condition, and that can usually get us qualified.
All right, Dr. Hegvik, thank you.
All right, this question tonight for Angela. Can bariatric surgery help with conditions other than weight loss, such as diabetes or maybe hypertension?
Yes, several of them, they can be treated and helped. Sleep apnea is a big one. Heart conditions, kidney failure, diabetes, a lot of the big major ones they can help with.
All right, Angela, thank you.
Dr. Hegvik, we talked about the criteria, sort of the requirements for people qualifying for bariatric surgery. How does a patient's mental and emotional health play a role in whether or not they're a good candidate?
That's an important thing that we look at a lot. And it's something that every patient that goes through weight loss surgery does have to have a psychiatric evaluation or with a psychologist. And we look at that, and I talk with them a lot about making sure to involve their significant other, their primary care provider, their mental health providers with that, so that they're involved with them post-op as well.
Thank you.
And another question tonight for Dr. Hegvik. Let's get straight to this question. What are some of the potential risks or complications associated with bariatric surgery?
So the biggest things that we talk about are some of the major ones would be a leak. Anytime we divide the intestine, that's something that can happen, or you can bleed from that location, or it could kink or narrow. Other things that we can deal with, and those are really uncommon things. The most common thing would be nausea, constipation, things that we can manage, and we're really used to managing in the office.
Okay. Now, here's a question from one of our viewers, and if you want to send in a question, you certainly can. Just send it to connect@ktiv.com. Now, Brenda is asking, what weight loss medication do you recommend for someone who's struggling to keep the weight off post-weight loss surgery? Dr. Hegvik, what are the medications that are out there?
So the most common thing that we see now is going to be the GLP-1 medications. We see those a lot. They've become really popular, obviously, Ozempic and Wegovy, and they do help us. I think if people have troubles, with weight regain after surgery, they can always come in and see us. And the main thing is that we want to get them back on track. We want to see them, see how they're doing. What are their complaints? Where are they struggling? We have a dietitian that can help us in the office, and she does a wonderful job with that. And then if we determine that medication is something that we can do, I would say semaglutide is something that we use a lot of, and it can help.
Thank you, doctor.
And if you have a question for our panel, all you have to do is send it on over right now to connect@ktiv.com, and we'll try and get you an answer before the end of the show.
Time to take a break, but we have lots more from our panel coming up.
That's right. In the next segment, we're going to look at alternatives to surgery and the process itself. Shifting the scale returns in 1 minute.
Bariatric surgery isn't the only option to lose weight, with a lot of medications for that purpose recently hitting the market. And I want to ask Brenda this question: what determines if someone is eligible to get injections to help lose weight?
So there are a few things we look at. The first question we ask is if they're diabetic. Now, the GLP-1s are obviously used to treat diabetes, but we don't manage that in our office. So it's, for us, it would be if you're diabetic, we would say we'd refer you back to your primary care provider. We also look at what we call contraindications, and there's really two that we always ask about. One is if they have a personal or family history of medullary thyroid cancer, or a personal or family history of multiple endocrine neoplasia type 2. Those two things would definitely be a reason that somebody would not want to take the semaglutide.
For the patients who do want to take part in a medical weight loss regimen, what are some of the common lifestyle changes that they'll need to make?
Absolutely. We do talk a lot about this medication as a tool. It's used to help jumpstart their weight loss. So we talk about while they're taking the medication, we want them to work on making those positive lifestyle changes, which include plenty of fluids. 64 ounces is kind of the magic number we talk about with bariatric patients. I also recommend just a complete multivitamin to help fill in some of the cracks. And then the big ones are definitely making good dietary choices and then increasing their activity and exercise.
One thing I think we need to address are any possible side effects from a medical weight loss regimen. What side effects are there, and how does CNOS help manage that?
Sure. So we can see a couple different things. Overall, the medication is really well tolerated by most people, but we do have occasionally people say they get headaches or fatigue, dizziness. Those typically I tell people, look at when was the last time you ate or last time you drank. With this medication, you get the appetite suppression, the food noise is quieted, and it's not unusual when they get to a dose that works for them that they're going to get busy and forget to eat. Really? Yeah, so I always say if you start feeling kind of crappy throughout the day, just think of the last time you had something to eat or drink. That's the first thing that I do. And then because this medication works on our GI system, it slows it down to help us feel fuller longer, we can get some GI side effects. We do see some constipation, which again is easily treated with over-the-counter medications. Occasionally we see some diarrhea and vomiting, not very often. And again, that can be treated symptomatically. We do get some nausea, some patients that complain of nausea, and we give them some recommendations of how they can treat that at home. Big one is probably just eating their food slowly. Because we're slowing down that GI tract, and if they eat too fast, they keep compounding what's already in their stomach. And the last one we see occasionally is bloating. And as far as recommendations for that, we say stay away from carbonated beverages and then drink between meals so that at meal times you fill up on healthy, nutritious food and not add to the bloating effect with all the fluids.
All right. Thank you, Brenda.
Yes.
All right, a common phrase, of course, preparation is key, right? Well, this question is for Megan. What type of preparation is needed before undergoing bariatric surgery, both physically and mentally, Megan?
Yeah, so as Brenda was saying with the GLP-1 or semaglutide, weight loss surgery is also just a tool. So when we are working with patients to get ready for the surgery itself, there's a variety of things that we're trying to prepare them for. I'll start with the mental side of things. So mentally, as Dr. Hegvik mentioned, we are having the patients undergo a psychological evaluation to not only make sure that they are ready to make this decision to have surgery, but also that they're prepared for the stressors that are going to come. As patients are going through the educational program, we've continued to add more and more mental health aspects to the program itself. One of the big ones that we talk about with patients is eating triggers. Why do we eat? You know, we eat for hundreds of reasons in our society, and being hungry is one of them. So we know the surgery addresses physical hunger really well, but it doesn't address the emotional eating and the social aspects. We also talk a lot about support systems. We hope that all patients have a really good support system as they're going through the process. And, you know, if not, we want to be able to give them as many resources as possible because this is a life-changing event and support is everything for that. Physically, there are just as many changes that we are preparing the patients for. And I think a lot of people think they're coming to meet with a dietitian so that I can tell them how to eat. And although we do go through that, it's more of physically, how are they going to eat? This surgery definitely changes some of the dynamics in how the digestive system works. So we are looking at more of eating techniques, as Brenda mentioned, eating slowly, chewing thoroughly, not drinking with meals. These are just some of the things as patients are going through the classes, we are having them week by week really dive into not only why these lifestyle changes are important, but how they're going to do them, how they're going to pull them off on a logistical basis.
Okay, and while we talk about lifestyle, are there specific lifestyle changes or diets that a patient really should follow leading up to surgery?
Yeah, we have all patients follow a 1-week pre-op diet. Okay. But again, the big thing for patients is looking at their lifestyle on a day-to-day basis. I don't want patients to go on a strict diet prior to surgery, but really look at, what do I eat on a day-to-day basis? How could I be making practical changes to the diet? We want them to be able to stick with this diet for the rest of their life. So again, in that week leading up to the surgery, we have patients follow a special diet that helps their digestive system get ready for the surgery itself. Okay. But in the classes and in leading up to the surgery, we're really just focusing more on healthy lifestyle, making sure they're consuming adequate protein, knowing good beverages that they can drink to keep them hydrated, and really starting at the meal planning, grocery shopping processes so that they already have their day-to-days and household set up for what's coming with the surgery.
Because again, it's a lifestyle change, not a quick fix.
Absolutely.
So, all right, preparation is key.
Yep.
Thanks, Megan.
Yep.
Another question for Dr. Hegvik. We touched earlier on about how long the 2 different surgeries that you perform take. What can a patient expect during surgery? How is the surgery done? I know you get a little high-tech help here.
Yeah, so I do both of these minimally invasively. The sleeve gastrectomy typically is done laparoscopically. We do our gastric bypass robotically, and mostly the reason for that is the ability to sew inside the abdomen is so much nicer with the robot, but both are really are nice operations that we can do with little incisions. That's the main thing. What
blows me away is that there's so many little, you call them wristed instruments on the robot, the Da Vinci, where it actually can do that sewing.
Yeah. Yeah, and it's a fun part for me as a surgeon to get to be able to do that and use that technology, and it's made that operation a really a nice, enjoyable one.
I know you joked, you know, people have asked you, what do you do during the surgery? Oh, you go have a cup of coffee, which is not true. He's actually in the surgical suite. You're just a couple of feet away. Yeah, we get to sit over there, and the ergonomics are really nice. We're like you said, just a couple feet away from the patient, but. Yeah, it's really nice technology. So here's a 2-parter for you. Where are these surgeries typically performed, and how long do patients usually stay in the hospital after surgery? So we do our weight loss surgery at the Dunes Surgical Hospital, which is in Dakota Dunes, right next to Sioux City. And our sleeve gastrectomy is actually, for the last about 1.5 to 2 years, have gotten to go home that day. There's a couple criteria that we use. We want them to be under the age of 65 and a little bit smaller BMI. They get to go home that day, which is really nice. And my gastric bypasses, I usually keep in the hospital one night. Okay. But of course, if there's anything that we need to do, we can keep them overnight longer if we need to. Very good. Thank you, doctor.
All right, we're going to continue our coverage with lifestyle. This is the big topic. We have a question coming in tonight from a viewer. This is for Megan. Can you tell us about the best lifestyle changes to help us be successful in losing weight and then keep it off? Even after surgery, how do you stop your bad habits and keep all that weight off?
Oh, such a good question. So I think the big one at the end of the day is patients really being practical. You know, in our diet society today, diets don't typically work well for the long haul, and it's because a lot of diets are really based on very restrictive eating. So again, when we're working with patients, we're really looking at what are you doing from a day-to-day basis instead of wiping the slate clean and starting from scratch. If we can get them to make more manageable changes on their own, we just see longer term success, and it doesn't seem as daunting, right? If you're starting a diet, I'm kind of telling you all the things you need to change overnight. So we really like to work at more of a long-term approach, and I always tell patients, if we can prioritize our nutrition and focus on moderation and not be so restrictive, it's just a happier way to live. You know, nobody wants to eat a restrictive, boring diet for the rest of their life. So I can't think of any food after weight loss surgery that I would tell a patient they can't eat. I don't want them to eat cake every day, but if they're at a birthday party, I expect them to have a little slice of cake with their family. So focusing on that, I think, not only makes the patient mentally happier, but it's just more realistic to stick with.
I don't want to eat lettuce every single day, Megan.
No, me neither.
All right, great response. And all of you, we want you to weigh in. We want to hear your questions. So if you have a question for our panel tonight, go ahead and send it on over to connect@ktiv.com. We'll try and get you an answer before the end of the show.
Time now to take another break, but of course, more from the panel coming up.
In the next segment, we're going to look at the recovery process from surgery and post-operative care. Shifting the Scale returns in 60 seconds. And welcome back to Shifting the Scale. We're now focusing on what happens after surgery. We're going to start with a question tonight for Angela to answer. How do you manage post-surgical pain and discomfort?
Patients typically go home with like a tramadol, something for pain to go home with if needed. But typically within a day or two, they're transferring over to just Tylenol.
Oh, wow.
We don't use any ibuprofen products or anything, but usually they'll just need that tramadol just for a few days and just kind of for breakthrough pain. But typically patients do really, really well.
That's good news.
Yes,
All
they
right,
do
thanks,
really
Angela.
well.
Brenda, here's a series of questions for you. We'll start with this. What's the recovery timeline like? When can patients start moving? When can they start exercising again?
It's a very fluid timeline. It's just like the weight loss is an individual journey, so is the recovery. Most people by that 2-week appointment, though, they're feeling pretty good. They've gotten back to some of their normal activities of daily living. A lot of people have gone back to work. It depends a lot on what your work per se is. If you do a very physically demanding job, it's probably going to take a little bit longer before you're back with no restrictions. Sometimes we can send you back on light duty, which means we may limit the weights that you can lift or the hours you can work, the activities you can do. People that have more of a desk job or a job that's not physically active can go back quite a bit sooner. We use the adage of let pain be your guide. So if you're not having pain doing it, you're free to do it. The one thing we do probably restrict more, though, is just kind of the watching the lifting heavy objects and things like that.
So let pain be your guide, let Zoom be your friend.
Yes.
Just zoom in if you can to work. So you answered the next question that I had, so I'm going to move on to this next one. What advice do you have for patients about the exercise after surgery? I don't think anyone's going to do CrossFit after 2 weeks, but how do you suggest that they start?
Typically, we always want them to start light and low, whether it's activity around the house or in the gym, the exercise portion of it. Just be smart about it. We want them to try something. If it goes well, they can progress to a little bit more activity, a little bit longer duration. And obviously there's some activities are easier than others. Things around the house is a great way to start, doing some laundry, doing some dishes. And then starting their exercise program. Once they've had a chance to really physically heal, we kind of cut them loose and let them start whatever activity that they want to do.
All right. Thank you, Brenda.
Yeah, so as we talk about this post-operative care, how a patient's response is followed in the long term, the first question is going to be for Angela tonight. So what are the most common challenges patients face in the weeks and months following surgery?
So we follow them pretty closely after surgery, and we kind of will go through what to kind of expect. After that 2-week, we don't see them again for till the 1 month. So they'll go home and kind of have to really work on like the tools that Megan gives them in class. Work on those sips of water, getting that fluid in, trying to prevent like constipation, increasing their exercise. So sometimes they'll go back a step before they'll go forward, but typically just helping them with their pain, watch that diet, and just kind of follow up with them, make sure everything's moving forward.
And when you talk about follow-up, how important is the follow-up procedure for the 2-week, and then you said, what was it, 6 months? Or
so we'll see them again about the 6th week,
okay,
and then we see them about 3 months, and then 6 months. We always see them sooner if needed, but patients do pretty well with those short follow-ups, and we always touch base with them. You can call and go through the diet, and they have a nice little notebook. They can go through any of that information, and it's important for them to follow up with us just so they kind of stay on track, and it keeps them pretty accountable for.
I was going to say, so that follow-up is critical for them to come back.
Yeah, so we definitely ask those questions every time they come in. Are you getting your water, those 60 ounces? Are you getting your protein intake? Are you following your vitamin regimen? And it does kind of just keep them accountable.
Okay, so when we talk about portion sizes, we're going to ask Megan tonight, what should patients really know about portion sizes and those eating habits after surgery?
Yeah, so we know this surgery significantly reduces the size of the stomach. So we're taking these stomach pouches from the size of a football down to the size of a golf ball or small banana. So portion sizes are very significantly reduced. Patients start out eating about 2 ounces a meal, which is a 1/4 cup.
Oh,
so
wow.
Very small portion sizes. And we want them eating 3 times a day with 1 planned snack. So we really focus on maximizing the amount of nutrition that they can get in every meal. So they really have to prioritize things like protein, in the early stages. What a lot of people don't realize is when Dr. Hegvik creates the stomach pouch, he creates it very small, knowing that as the patient uses their stomach pouch throughout the first year, it is going to increase in size a little bit. So this question of can your stomach pouch stretch? Yes, but we wanted it to. You know, he created it so that it would. And so over the first year, the patient's portion sizes are slowly, steadily increasing. When they're about a year out from surgery and then for the rest of their life, patients are eating about 8 to 12 ounces. So about a cup to a cup and a half.
Each day?
At each meal, actually.
Oh, okay.
So 8 to 12 ounces at each meal. So as their portion sizes increase, one of the things that we focus on then is adding in more variety. So we focus on protein first, but as they're able to eat more, obviously more vegetables and fruits, more grains, because we really want them to have that well-rounded meal.
And you had mentioned earlier the support group, Megan. Your team offers a support group for those patients at CNOS. So tell us a little more about who could attend and what topics are discussed.
Yeah, I love our support group. It's one of my favorite things that I do at the clinic. So we have a support group that meets the first and third Tuesday of every month, and it's really a great combination of patients who have had surgery, individuals that are maybe thinking about surgery, patients that are going through the educational program. It's this great little wealth of information. And we cover topics, hot topics, you know, in the weight loss surgery world that focus around diet and exercise, mental health, things like that. Patients are picking topics on a quarterly basis. But my favorite part about support group is the fact that these patients are able to sit in a room full of individuals that completely understand what they're going through because they've been through it themselves. So we do a lot of open question and discussion type forums, but it's rare that these patients are out in the world surrounded by people who know exactly what they're going through.
So can anyone attend?
Anyone can attend. We're free and open to the public. We do get patients who had surgery in Sioux Falls or Omaha, Mexico. And not only is it for the patients, but it's for the patients' family members and other supporters because we also want them to see and experience what they're going through.
All right, Megan, thank you.
If you've got a question for our panel, there's still time to get it in. Simply send it to connect@ktiv.com. We're going to try to get them all answered by the end of this broadcast and also on the digital side on News 4 Now. It is time to take a break, but there's more coming up.
All right, so in the next segment, stay with us. We're going to look at nutrition and exercise following a weight loss surgery. Shifting the scale will return in 1 minute.
And welcome back to Shifting the Scale. Just a few minutes left on air before we flip over to our digital side on News 4 Now. We want to talk about the lifestyle of patients after surgery.
That's right. Let's get one last question in for Megan tonight. So we have been talking about nutrition throughout this episode, but how critical is nutrition for long-term success after a bariatric surgery? And what are some of the most important foods patients should incorporate into their new lifestyle?
Yes, so nutrition is very important, and we not only look at food and nutrition from a dietary standpoint, but as Brenda mentioned, we also focus on making sure patients are getting in their micronutrients, their vitamins, minerals, nutrients. So we do have all patients take special bariatric supplements really for the rest of their lives. And then looking at just from a dietary standpoint, again, we really like to focus on a protein-focused diet, which means patients are getting in a variety of foods, but they're always looking at that protein first and foremost. We're basing protein goals really around the patient's weight and stature and activity level. And then from there, we're encouraging them to fit in a wide variety of veggies, fruits, grains, again, focusing on getting the foods that they need, but also foods that they want so that they can, have a tasty diet, but also a really healthy diet.
All right, great information. Thank you, Megan.
Our half hour has flown by, but we want to thank all of our folks from CNOS, Dr. James Hegvik, and a shout out to his 4-year-old watching at home, Brenda Van Scoik, Megan Cleveland, and Angela Suarez for joining us tonight and sharing in their expertise.
Yeah, so that's all we have on KTIV. However, the conversation continues. We are headed live to our streaming service News 4 Now. We want you to join us. We're going to answer even more of your questions live tonight. So we'll see you in just a few seconds as our conversation continues.
And welcome back to Shifting the Scale. We're on News 4 Now from now until we've answered all of your viewer questions.
All right, so let's get to our next question. This question is going to be for Megan tonight. What are some key changes patients need to make in their daily diet after surgery? And how do you really kind of guide them through this journey and process?
Yeah, I think as Angela was mentioning earlier, so if you think about it, we are doing surgery on the patient's stomach.
Okay.
So one of the big things after surgery that we focus on is the healing of that stomach pouch, meaning we need to give it a little bit of a rest. So initially after surgery, all patients are going through a diet progression.
Okay.
We start them off on a clear liquid diet, things like juices, jellos, popsicles. From there, we move to thicker, fuller liquids like protein shakes, thicker soups. Shortly after that, they're moving on to a pureed diet, which is things like scrambled eggs, mashed potatoes. And then I would say within about 3 to 5 weeks after surgery, patients are back to a soft but normal diet. And so we're really focusing on textures, consistencies. There are some food intolerances that can come with this type of surgery. So things like too much sugar, very soft doughy breads, which we all love, so that's a hard one to stay away from. We know that really fibrous meats, vegetables, and fruits can be harder for that stomach pouch to break down. So we're really focusing on kind of upping the consistencies as time goes on.
Okay, and you talked about protein a little earlier in the show. So let's discuss the importance of protein and hydration for those patients post-surgery.
Yeah, protein is everything. Immediately after surgery, protein is helpful from a healing standpoint, but from, muscles to helping with, vision, antibodies, enzymes, the creation of those. As Brenda was talking, we know physical activity is so important, and protein is stored in our muscles essentially. So if patients aren't eating enough protein, their bodies are finding it in those muscle stores. So.
Yeah, well, I was going to ask, so you had mentioned some of the foods that they kind of work their way into, but is there anything that they should actually absolutely avoid?
Not necessarily.
Okay.
Again, we know way too much sugar is not a good thing. So we give them some sugar guidelines, teach them how to read labels. Basically, we focus on chewing. So anything they can't chew to an applesauce consistency, I say if your mouth can't break it down, your stomach's probably also not going to be able to break it down.
Oh, okay. Good advice there. And is there anything that you tell them to avoid just to prevent regaining any weight?
Yes. As far as foods go, the big one is soda, which I know breaks a lot of hearts. We know soda is pretty heavily linked to weight regain. As far as behaviors, we know things like grazing is by far the #1 reason that patients gain weight back. And grazing is, these patients are never going to be able to eat a large amount of food ever again, but they can take a large amount of food and pick on it over a period of time. So it's that constant snacking or picking. This little stomach after surgery works great for that. We recommend not drinking with meals so that they're filling up on their nutritious foods and not having those foods slide through the stomach. We know getting in enough protein, staying adequately hydrated. So we have them watch things like their caffeine intake because caffeine tends to dehydrate us. being physically active, taking their vitamins, you know, kind of all those core things. And obviously we're teaching those concepts really early on in the education. And then as Angela was saying, that's why we're following up with them to make sure that they're still practicing.
And when you talk about enough protein, how much is enough for one day?
Yeah, so we recommend at least 64 grams, which is a lot, you know, especially when these patients are limited in how much they can get in. They're getting a lot of their protein from, you know, animal products, so meat products, dairy products. We do have some nice protein fortified foods on the market, you know, high protein shakes and bars and pastas and things like that we recommend. But it's an effort for sure.
Okay, so many of you are weighing in right now on social media. And so we're going to begin with this question from one of our viewers. Abby posted, does weight loss surgery ruin your metabolism down the road?
And we're going to throw these questions open up to the entire panel. So whomever can answer, please do.
That's a great question. And the answer is no. That's the quick answer. But you know, weight loss surgery is actually considered a metabolic surgery. That's actually something that helps an individual's metabolism. And we're learning so much about metabolism. We used to once think if you struggled with your weight, it had nothing to do with metabolism. Now we know it has everything to do with metabolism. As obesity is a disease, there's a lot of things that filter into this. But what we also know is you can improve your metabolism. Weight loss surgery has been kind of known to help reset some of that, but also just through the healthy lifestyle changes that we're coaching patients through, eating healthy, moving your body, managing stress, getting plenty of sleep, being adequately hydrated. If you're following all of those things, the hopes is that you actually are improving the health of your metabolism long term.
I see where the mental aspect really comes in. You have to be prepared and ready to do this.
Absolutely.
Thank you, Megan.
This question came in from Tony. He asks, are these surgeries typically covered by insurance? And that's probably a question a lot of people considering weight loss surgery are asking.
Yeah, I would say the majority are. The sleeve gastrectomy and the gastric bypass are well-known operations and are often covered. But that's one of the great things about our program is we have a coordinator that can go through your insurance, look at it with you, and figure out, you know, if it's covered but needs some stipulations, what can we do to help you get through those things? But I think having that coordinator is a really key part of the program.
And I know, Megan, you brought this up during our interview that some insurance companies will require a certain amount of education that CNOS would provide.
Yes.
Before the surgery can happen.
Yeah, and that can be as much as 6 months. You know, most insurance companies require a little bit of education, which I don't think we would have it any other way than to educate them anyways. But there are all sorts of guidelines and criteria. And I would add to Dr. Hegvik, if somebody's insurance company doesn't cover weight loss surgery, there are self-pay options. And we feel like we're very competitively priced. And we feel like it's an investment that somebody's making in their health. That would definitely be, we have so many patients say, yes, that was, you know, $10,000 up front, but I'm saving that on medical costs, food costs, and living longer because of it.
Yeah, absolutely.
All right, so another question from one of our viewers. Chad asked, what about alcohol? Should you or should you not? Who wants to take that one?
You know, what I tell my patients in class when we first meet is, I'm not an all or nothing kind of person usually. I think anything within reason. But I would say at least 6 weeks after surgery before you try that. A couple reasons. One is alcohol has a lot of calories, and it doesn't fill you up. So you can drink that, and it's not going to give you any nutrition. The other thing is you're probably going to feel the effects of it a little bit sooner when you're not have much in your system and you may have dropped your weight. So just being careful, and it's also a diuretic. It makes you go to the bathroom a bunch. So it may dehydrate you when you're already trying to get your fluids in. So again, as long as you can get your fluids in and we get that 6 weeks out, you can try having a beer on the golf course or whatever it may be. But you know, just be within reason.
Next question comes to us from CNOS bariatric nurse Kathy Hart, sending a question in from sunny Florida, I think is where you are. So Kathy, thank you for doing the interviews that we did with you and contributing to this special. How important are bariatric vitamins, and can I substitute with over-the-counter vitamins?
The answer is not no. You know, you can substitute over the counter, but I think the thing that we really want patients to remember, bariatric vitamins are created for bariatric patients. So they are just so much more specific to not just the nutrition that a patient would need, but how the vitamins are broken down. In the vitamin world, we have something called bioavailability, and that's really how easy can something be broken down. And what bariatric vitamins have in common is they're really targeted towards the recommended amounts that these patients are needing. They're putting the supplements in a way that is the easiest for the patient to be able to not only break them down, but of course absorb them. And when we look at the cost, I think a lot of people think that bariatric vitamins are going to be more expensive, but they're definitely condensed because these patients can't take a lot of pills. So bariatric vitamins come in very small packages, and so patients are taking less. So what they would take in maybe 3 supplements, 2 or 3 bariatric supplements, they could probably get that over the counter, but they're probably going to take 10 to 12 different supplements. And the supplement aisle is a very confusing place. So if we can take the guesswork out of it, that's our ultimate goal.
And they do absorb differently.
Absolutely.
She's explained to patients that they absorb, the bariatric ones are meant to absorb slower, so they can absorb that a little differently. So it is good for patients to know that too.
Okay. More viewers checking in, and you can send your question if you want to connect@ktiv.com. Linda asks this: what nutritional deficits can be complications to bariatric surgery? Do those deficits depend on the type of surgery?
You know, what nutritional? Yes, nutritional deficits can certainly be a complication of surgery. If we have, you know, somebody that you just don't take in as much, and there's some really important vitamins, but we check those prior to surgery, and then we follow them afterwards. So if they're low previously, we'll check them at 6 months afterwards, or sooner if we need to. A lot of them are fat soluble, so it takes a little while for them to get out of your system. Some of them are water soluble though, and you can go through those a little bit quicker. So we do start our patients on vitamins at 6 weeks following surgery. But sometimes, we used to try it at 2 weeks, but their stomach just didn't tolerate it very well yet. They can be a little bit tough to get down. So at 6 weeks, we start them. But usually, you know, if there's symptoms that we follow that seem worrisome to me, I'll check their vitamins sooner.
Okay. All right. Thanks, doctor.
And while we continue our questions that are coming in from viewers tonight, this viewer submitted a question saying, can you do weight surgery on someone who does not meet the BMI requirements?
Yeah, I guess I wonder, is if your BMI isn't high enough?
Yeah, that's what I'm assuming they're asking, like between the 35 and 30 range.
Yeah.
You know, we don't commonly do it. It's not a normal thing, but I think it's something that we can certainly have that discussion and see where they've been and where, you know, what they've tried for weight loss. I wouldn't say no, it wouldn't be covered by insurance, but it's something that, you know, I have had discussions about with other surgeons.
And on the other end of that scale, as far as weight or BMI, one of the patients that we interviewed, Jennifer Anderson, she was asked to lose 83 pounds before she could have the surgery. She ended up losing 103, overachiever there. So good on you, Jennifer. But she lost that amount of weight in order to have the surgery. So that can happen as well.
Yeah, she did an awesome job. We don't often ask for weight loss. There are some BMIs that we will ask, that we try to get down to a little bit lower, just to make surgery a little safer. Okay. As your BMI gets higher, the liver can get in the way and make surgery a little bit more of a challenge. Okay. But typically we don't ask for weight loss, but it just depends on, you know, body habitus, where they're keeping their weight. And sometimes, you know, if their BMI is really high, we'll say, okay, let's try this together. Let's see where we can get to, and then proceed with surgery if we can get them to that healthier spot.
Okay. Next question. This is from Mark. Mark says, I've hit a plateau. What can I do to jumpstart my body? I'm currently using a cane. Suggestions?
Yes. Nobody likes to hear this, but I'm a big food journal. I always recommend food journaling, and everybody rolls their eyes at me when I recommend food journaling, and it's fine. And I'm not a big believer that you need to food journal everything every day for the rest of your life, but food journaling really helps people be aware, especially when you're on a plateau. And there's usually a reason why somebody's plateaued. So we'll have them food journal. It's interesting because I will typically see patients if they have experienced weight regain or they're on a plateau. I schedule them out at least a week and I say, okay, between now and then I want you to food journal. Usually the patient comes to that appointment, they've already figured it out. They see what they're doing. They're not getting in enough protein. Maybe their exercise has become very stagnant. It can be simple things like their medications changed up and they were taking off their water pill, and so they're retaining a little bit of fluid. They've gotten into grazing, you know, some of these bad habits. So if they can, you know, we're obviously here to help them, but food journaling is a great way for them to see it, and then we can take those things and hopefully help them create a plan to move forward.
Just a quick follow-up, Megan. A food journal, you're talking about a physical journal that you write everything in. Could you substitute with one of the million apps where you log your food every day?
You absolutely can. So I tell patients a notebook, a daily planner, an Excel spreadsheet, random Post-it notes laying around your house. There's really great apps out there, and we actually work with one of the best apps I've ever found. It's called Berrytastic. It was an app that was created for bariatric patients. So not only are you able to track your intake, and it calculates, of course, all the nutrition, you're able to take pictures of what you eat, scan the barcodes, talk to text, but it also just has a great Facebook community with it, recipes, you know, reminders to take your supplements. So there's a lot of great apps out there. Baritastic is free and anybody can use it, but yeah, whatever helps you be more aware, whether it's super tech savvy or pen and paper, it doesn't matter.
This question comes from, oh, I'm sorry, Brenda, I didn't mean to cut you off.
Just to add to that, Megan touched on the exercise. So if I'm seeing patients in the office that are coming with weight loss plateaus, I've had great success with not only the food journaling, that's the first thing I tell them. Secondly is to look at their exercise. And just like Megan said, they get stagnant. What people do is they find an exercise they like and they keep doing it, and it gets a little too easy for them. They haven't thought to push themselves, either increase the intensity or increase the duration. I tell people actually shake it up completely. Look at a totally new activity because we want to use the whole body, every muscle group involved with it. And then also if they're far enough out, like when they hit that year to 18 months, I've had good luck with people doing what we call a reset diet, where they kind of go back to the beginning, following more of a diet that they did right after surgery. Again, the idea is kind of just shaking it up and shocking the body almost. And I've had a lot of success with that.
Okay, very good. The next question comes to us from Elise, and she asks, how many food allergies do people have after surgery, such as dairy intolerance? And we did touch on people can develop sensitivities to food afterwards.
Yeah, and we know with gastric bypass, patients can become a little more sensitive to, you know, develop like a lactose intolerance. I wouldn't say that there's any allergies or anything of that nature, but more intolerances. And so when we look at intolerances, lactose is a bit related to gastric bypass, but it's very, very rare and really seems to be temporary as it fades over time. The bigger intolerance would be, again, the sugar, the soft doughy breads, the really fibrous, you know, vegetables and fruits, things that you can't chew down. But I always explain food intolerance as kind of a twofold. It's either the food or how you ate it. So going back to those key, if you took too big of a bite, if you didn't chew thoroughly enough, if you just ate too quickly, you could have it. But I think a big misconception about weight loss surgery is, you know, oh, I know so-and-so that had weight loss surgery back in the day and they get sick all the time. It's not, you know, you have to remember back in the day in the 80s, 90s, they didn't have education. These patients weren't taught how to eat differently. So we tell patients, if you are experiencing a food intolerance and you can't figure out why quickly, you need to call us. You know, there might be something physical that we need to look at because we're not setting them up. We don't want to set them up for a life of not tolerating food.
And we're getting several questions in tonight via social media. So we want to present this question to one of you this evening. All right, this is from Brittany. She says, I'm a bariatric patient of RNY gastric bypass. At 2 years post-op, 175 pounds off and maintaining. It is a tool and lifestyle change long-term for sure. What would you as a medical team give advice to a person really struggling with weight loss and contemplating their options? And what is a good piece of advice for post-op long-term? Kind of a long question there. Who wants to take that one?
I can take the first one. I think, you know, people that are contemplating it, I think one of the great things about this is that you come in and have a discussion with us. We have a really great team. You know, I think that's one of the things that we're really proud of is we have a really good group of people to sit down and talk with you and hopefully break down some of those barriers, the things that you're nervous about. A lot of people spend a lot of time thinking about, should I have surgery? When should I, you know, and they spend, we talk about 18 months before they come in and see us. But most of the time after they've been in the office, they're like, gosh, you know, this isn't too bad. And they really start to think, okay, this is something, they get excited about it. And that's one of the fun parts, is start to see that excitement in them, start to see that change that can happen.
All right, and Brittany has another question. We're going to pop that on the screen for you tonight via social media. Suggestions to people either thinking about surgery or have had bariatric surgery. Are there places for support? A lot of people think of these surgeries as an easy way out. She says, definitely is not. It's a tool, takes hard work. What support is there for people out there? And you had mentioned the support group. Is there anything else besides that support group that you talked about earlier?
Yeah, and you know, with the power of social media, I think there's good and bad that can come with that. I think there's really great support groups on social media. And what I like about the online support that patients can get from social media is it's there 24/7, right? And we're not. So I like that. I also think, though, there is a ton of misinformation, just like she was saying about, it being the easy way out. So when I talk to patients about social media, I'm having them assess the different pages they're on. Is this helpful? Are you getting good information? Does this kind of align with what you're getting from our clinic? Weight loss surgery is done all over the world, and there are different thoughts, and a lot of social media platforms are not necessarily run by a doctor, a nurse, a dietitian. So we want them to choose those wisely because we want that to help them, not set them back.
And for those of you watching that maybe didn't hear more about the support group, expand a little more on that you'll offer at CNOS.
Yeah, so we have a bariatric support group. We meet the first and third Tuesday of every month from 6 to 7 p.m. Our support group is free. Anyone can attend. We always cover topics, I say hot topics that patients are interested in hearing about. So quarterly, we're coming up with a schedule of things, but mostly we do a lot of just open question and discussion. And as I was mentioning earlier, I think the best thing about our support group, I run it along with Kathy Hart, our bariatric nurse. We're there to give information, but the best part is really just having patients come together. And so when a patient is, newly out from surgery and they're having an issue with something, they have a whole slew of patients in the room that can answer their question. Those are the true experts. They're living the life every day.
It's also reversed from that too. I feel like the support group, you could have somebody who had one 20, 30 years ago, and then someone who had one a month ago, and their differences are huge. And sometimes it is nice to see, like, oh, this is new since I've been to class, or this is new education.
That's a great
There's just
point.
always things growing and things changing in the support groups and the classes that maybe 20 years ago we didn't touch on.
Yeah. It probably makes patients feel comfortable. No question is stupid. They're all in the same position. Yeah.
And our patients who have had surgery definitely want to pay it forward. So they love helping those that are new to the process. And like Angela said, you also see this reinvigoration of those that are fresh out from surgery and super excited. Those that maybe are on a plateau or out from surgery years and years. Just the conversations, I think it's really helpful both ways.
Yeah. Okay.
I always tell patients too that I think even if you don't think you need to go, sometimes you going is the support that somebody else needs. And I think that's kind of what they're alluding to. And it really does. It's funny when they come back after support group and they're like, it's exactly what happens for them. So, and I think family support is huge too.
Family support is a
I
big
think,
one.
we have a few patients where the family isn't supportive and it's just so much more of a struggle. I think being open and honest with their family and trying to get them to explain why they want to pursue surgery or the medical weight loss portion of it, I think that's huge too.
Yeah, two of the patients we had in our series of stories were unique. Jennifer and Travis Anderson, who decided at the same time to both have weight loss surgery, and they had surgery on the same day and then were able to go through the steps to get to that first week, that 6-week appointment, that 6-month appointment, and that year appointment, and constantly support each other every step of the way.
That's been my favorite, I think, is seeing the husband and wife couples that come in and we schedule them together. Some are like, no, let's me go first and then them. And we're like, no, I would do it together if you can. And then they do. You see them recover and kind of those symptoms they go through, and they support each other. And I love watching the husband and wife.
Accountability.
Yes, it is.
That's true too. Okay,
100%.
what were you watching what you eat today?
Yeah.
So
And you can cook with each other and share.
Exactly.
I
and
mean,
making
did
that,
you take your vitamins today?
Yes.
Yeah. Well, it's a contest sometimes with them too.
And it is,
that
and
when
I
they
always
come
find
in.
it interesting, the ones that have the surgery and then the spouses maybe don't. And the surgical patient will come in and say, well, I've got my husband doing it now too. He's eating much better and he's lost 25 pounds since I've had surgery. So we do, that's a really fun thing to hear, is everybody's jumping on board in the household.
A very supportive environment.
Yes.
We have another question. This one came in via email from Abby. Can you stretch your stomach eventually after having the sleeve? And I know, Megan, you had mentioned, Dr. Hegvik, when you do the surgery, you will allow for that stomach to stretch a little over time.
The stomach in and of itself is very distensible. It moves a lot. So I tell people it's going to stretch a little bit, but that typically is not the source of weight regain. And that's where people ask about it a lot, is they'll say, oh, I stretched my small stomach pouch, or I stretched my sleeve out. Usually it's not that, it's the behaviors. And that's the stuff that we talk about, is getting back in touch with our dietitian with weight regain. But you will stretch it a little bit. Like when we talk about, you can eat more at 2 years after surgery than you can 6 weeks, but it's not necessarily going to continue to stretch out.
I have to tell you, this has been a fantastic conversation. We've really gotten a lot of great questions answered, and if there are any lingering questions out there, I'm sure that if you approach CNOS and these great doctors and nurses, they will be able to get you the right answer.
We appreciate all of you joining us tonight on News 4 Now. Thanks for being here with us for this extended digital edition of Shifting the Scale.
And if you want to watch the special again, we'll have it online tonight at KTIV.com and on our Facebook page and on our YouTube page and, of course, the News 4 Now app. Thanks for joining us, folks. We hope you have a great night.